The objectives for today's session with you are to define an age-friendly community and an age-friendly practice healthcare system. That's the 4M's, which we've already talked about. And we're going to identify what the components of that system are, give you a sense of how we do that and what we need to change in our practice. And finally today, we're going to help you create a plan for taking 2 actions or initiatives to promote age-friendliness in your current practice, whether as a student or a practitioner. This is the age-friendly healthcare model, the 4M's. I'll talk about them now. Age-friendly healthcare is defined as the 4M's, and I'll talk a little bit about the history of this in a minute. The 4M's include what matters for the patient. Medication, what impact does that medication have and what are the patient's preferences? Mentation, how is the patient's mental status, their cognitive ability, and so forth? And mobility, what is the patient's ability to move around, to do things for themselves, to engage in activities of daily living, as well as the social life. So we're going to talk about each of these in a little bit more depth in just a moment. But I'd like now to show you a video.
What's fascinating and wonderful as a geriatrician about taking care of older adults and working with older adults is the fact that they are very complex, that they vary, what we call heterogeneous. We become actually more and more different from each other as we get older and accumulate different life experiences. That's wonderful. And so in its obvious response to that with the healthcare would be that you would take on all that complexity and understand all the different moving pieces and respond to them. That's just too complex and hard for us to do. So what we have done with creating the 4M's is identify really what are the core issues that are important, no matter what your individual diseases are, no matter how much functional problems you may or may not have, no matter what your cultural or ethnic or religious background is, that these are the core issues that drive everything, that should drive all of your care and decision making. They are the issues that are the manifestations of the disease they have, and they are the things, if they work well, help us live our life. And if they don't work well, it keeps us from doing what we want in our life. So that's how we came up with those 4M's of mentation, which includes the 3 D's of the 4M's, depression, dementia, and delirium, as well as mobility and medications, because obviously older adults take a lot of medications that cause either benefit or harm. And finally, we think sort of the core M is matters most, because older adults really do vary in what matters most to them about their health and their health care. So we tried to take all this complexity and package it into the 4M's that are really manageable for individual clinicians and health systems to deal with.
We pride ourselves as healthcare providers in always doing patient-centered care. You know from your observations and your practice that we don't always do that. So one of the things we need to do when we're talking about an age-friendly community is to be sure that we really are focusing on our older adults. So we pride ourselves in this, and let's think of a time when you've witnessed something where it hasn't exactly been age-friendly, and think about how it might be different. Let me provide you with an example, and then I want you to think about some things from your own practice. This comes from an experience that I had with a 94-year-old friend of mine who was having surgery to have a stent, a uterine stent, or back up, a ureteral stent placed in the OR. I was with her because I worked at that institution in the pre-op space. The physicians who were going to do the surgery and the anesthesiologist came in to speak with her, but they didn't speak to her. They didn't know, even though I worked there, they didn't know who I was. They didn't know what my relationship to the patient was, but they began asking questions of me rather than of Selma. Think about experiences that you've had and how they have impacted on your behavior. What do you do when you're confronted with an older adult? How do you think about that person? Where do you start with your interactions? We do oftentimes, as healthcare providers and in our society, not pay attention to older adults. For whatever reason, another example of ageism. What's happening now in your work environment? Take a minute to think about things that you've seen in dealing with older adults that are reflective of ageism. What's happening to them? How are they treated?